All right, so this is part 2 for chapter 11, lecture video for the urinary system in your pharmacology books. So acute kidney injury and chronic kidney disease. So these are two separate diseases that affect the renal system. So your acute kidney injury timeline for development of this could be hours, especially with a major injury, days or weeks. So the prognosis of acute kidney injury is the kidneys may return to normal function with supportive care and resolution of the cause. With severe insults may result in permanent damage or may be life-threatening, so it just depends on what the situation is. Chronic kidney disease is a progressive damage resulting in the death of the tissue of the kidneys over time, and the prognosis of this is as irreversible. So a perfect example happened to a family member of ours, a younger guy, at the time was about 34. He was wanting to get in shape and was using a lot of those protein shakes. And one thing that people don't realize is that these protein shakes, the creatine, all of those things are not regulated by the FDA. Those are considered supplements, or natural supplements, dietary supplements. And so a lot of these places that sell these items are not really educated in how all of these things affect your body. And so when he was reading the information on the back, and it says, no more than 2 a day, there was no one really to tell him why it was necessary to not have more than 1 or 2 of those protein shakes a day. So he was having 4 to 6. He was trying to quickly bulk himself up and really get into shape. And after a couple months of this, he had an evening with friends where they were drinking alcohol, and the next morning he was found unresponsive. And so when he was rushed to the emergency room, they found that both his liver and kidneys were in total shutdown. And part of the problem was that the alcohol was not the catalyst in this situation. It was like the cherry on top. So the catalyst was the amount of protein shakes that he was drinking on a daily basis over an extended period of time. It was so much protein in his body that his body was not able to eliminate it properly, and it fully shut down both of his kidneys and his liver. So he was in ICU for many months. He was on dialysis. There was talk of putting him on a transplant list. They were looking at family members who were a match to be able to donate a kidney to him. But luckily for him, about 4 months into treatment, they kept him on dialysis to kind of give his kidneys a break so they weren't working so hard. They were able to take a break, the necessary break that they needed, and actually began functioning again on their own without any issues. So this would have been an acute kidney injury due to the excessive amount of protein that was used and taken, and it did resolve with supportive care. Obviously, he needed to have dialysis and have that supportive care to give his kidneys a rest, and didn't cause any long-term damage. So he is very lucky. So diabetes patients that are diabetic are very high risk for chronic kidney disease just because of the amount of sugars and all of those things going into the body. Diabetes wreaks havoc on all of the body systems, so that's one of the main causes of chronic kidney disease. So just in seeing the difference between an acute kidney injury and the chronic disease is progressive. It will continue to progress. It is not irreversible. You cannot stop it. You cannot fix it. Eventually, as they go through the stages of chronic kidney disease, they will eventually end up on total kidney dialysis and will need a kidney transplant. So disease treatments. So with the acute kidney injury, it's limited and short duration or short-term use of drug therapy, whereas chronic kidney disease, the drug therapy is used for reestablishing your fluid volume and treating any underlying problems, making sure that your body has enough iron and those things that are depleted through the use of dialysis. Hypertension management, because the higher your blood pressure is, the worse it is on the kidneys. And then using the dialysis in advanced stages of chronic kidney disease. So hemodialysis is a machine that is used to divert your blood. So the blood is diverted to a machine. The blood is filtered by the machine, so it's working as the kidney. The machine itself is working as the kidney. We remove your blood from your body, run it through this machine, it filters it, it cleans it, removes all the excess toxins, and then the blood is returned to the body. So it works as your kidneys, just as an outside source. Peritoneal dialysis is a little bit different. This uses dialysate fluid, which is placed into the abdominal cavity. If you look on slide 19, there's actually a picture that shows you how that's done. The fluid is placed into your abdominal cavity. The toxins and electrolytes will diffuse into this fluid, and then the fluid is actually drained from the abdomen into a bag. That is one way that they do that. That would be for earlier stages of chronic kidney disease. As that progresses, they will not be able to use a peritoneal dialysis. They will have to use hemodialysis. Anemia. So anemia is characterized by a deficiency of red blood cells or hemoglobin. It is due to the reduced production of the erythropoietin, which is a hormone that is secreted by the kidneys to produce red blood cells. In patients that have chronic kidney disease, they will use what they call erythropoietin stimulating agents, known as ESAs, so things like Procrit, which was one of the questions on your sheets that you did, or your daily assignments a couple days ago. It is used in chronic kidney disease to stimulate the red blood cell productions. There are side effects of these medications, which include hypertension, which is something we're trying to avoid, right, with chronic kidney disease. Seizures, there is an increased risk for blood clots because we are trying to stimulate the production of red blood cells, and sometimes that is too much. And then patients, of course, can always have an allergic reaction. So Epitin alpha is the generic name for Procrit or Epigen. This is used 3 times weekly. It is used specifically for the treatment of anemia for chronic kidney disease patients. Aranacept, which is used once a week or every 2 weeks, works in the same way. It's the same family, actually. It's just spaced out and given not as frequently. So medications that support dialysis therapy. So Senespar is designed to, or is given to, lower the parathyroid hormone, calcium and phosphate, which is something that is heavily removed from our body through our kidneys. It is used as to treat secondary hyperparathyroidism in chronic kidney disease patients that are undergoing dialysis. It can be given alone or in combination with vitamin D. Sevelamer, which is Renagel or Renvela, this limits the absorption of phosphate in the intestine, which will lower the phosphate without actually altering your calcium, aluminum, or bicarbonate amounts. This drug can actually interfere with the absorption of other drugs. So when this is used, the pharmacist is looking very closely at what other medications the patient is taking. Ergocalciferol, which is vitamin D, it's a vitamin D supplement, is not routinely given to patients until they begin dialysis. So one of the things with the dialysis machine that is not as accurate as your kidneys, so your kidneys inside your body are working as the filtration system. Your kidneys know what your body needs to keep and what it needs to get rid of. With the dialysis machine, it's kind of a set thing. It's going to remove everything in certain amounts. So if you're already depleted or you're close to being depleted of certain levels of things, it's going to deplete that. So we want to make sure that we supplement anything that could be filtered out through the hemodialysis machine. Folic acid is another one of those, which is vitamin B9. This is actually required for the formation of the erythrocytes, which is part of the red blood cells. Folic acid is given to renal patients daily. There's a specific vitamin that's called nephrocaps. This is actually one of the only vitamin supplements that I've ever seen prescribed as a prescription and covered through insurance, especially for veterans and patients on Medicare. These nephrocaps are a one in everything they need into one capsule of vitamin supplement that is formulated specifically for dialysis patients. So it has the folic acid, it has the other B vitamins that they need, and then including the vitamin C. So iron. Iron's role in therapy is it replenishes the iron stores within the bone marrow. Iron sucrose is the iron of choice. That was one of the questions that you had. Venifer is the brand name of that. It's very interesting when you make an IV bag of iron sucrose, it is black. So that's one of the things that kind of shocked me the first time I made it. It's, you draw it out of the vial, it's black, you put it into the IV bag and it's black. So that's just the consistency of the iron and the way it looks. It almost has a very dark, almost could be mistaken for a bag of blood, just not as red. It's just a very, very dark. Most of these can only be mixed with normal saline or dextrose, and some of them can be infused as an IV push. Others must be given as a slow IV and cannot be infused rapidly. But those routes of administration information are from the pharmacist. They will make those determinations. This is more just supplemental information for you to know. Levocarnitine or Conator is used for levocarnitine deficiency in hemodialysis patients, and it is thought that dialysis leads to reduced levels of levocarnitine in our body. So that's one of the reasons why that we would prescribe or dispense this. And then multiple vitamins. These are used to replete vitamin stores, which are thought to be depleted also by renal disease. So your kidney transplants. Okay, so we're going to just go into this, and that's where we'll stop for this part 2. So typical length of surgery for a kidney transplant is roughly 3 hours. That is a huge difference from what it used to be. Also, the way that they do it is much different. They used to have to cut you completely open, and now when you're a donor, they can actually do it laparoscopically. So they have been doing kidney transplants for many, many, many years now and have it gotten down to pretty much a science, which has allowed it to go from a 12, 14, 16, 18-hour surgery to 3 hours. Post-operative stay for the patient is a couple days. They want to make sure that the patient is adjusting well to the new kidney. They're starting them on their immunosuppressant medications. They want to make sure there's no underlying complications from having anesthesia, that they're getting up and walking and doing all of those things, and the kidneys are starting to function, urine output starts to happen. Overall recovery time is about 6 months. So patients must be on a maintenance immunosuppressant agent, which is required to prevent organ rejection. So think about your immune system. Anytime a foreign invader or foreign body, in terms of a germ or virus or bacteria, gets into your body, you run a fever, these things, those are your immune responses. So your immune response and your immune system is now on the attack. So unfortunately, our bodies are so incredibly smart and amazing that it can recognize when it's missing an organ and something has been placed in there. It knows, hey, this is not my kidney, and so it's going to send the immune system on a full attack. And If they do not take immunosuppressant medications, the body will reject the kidney or any other organ. It will not work, and the transplant has not been successful. They start off on higher doses of immunosuppressants when you first have the transplant surgery. Over time, that can be decreased to a maintenance dose, but patients that are organ recipients will be on these medications lifelong. They will never ever be able to stop them. Here is the contraindication to that: is if you are suppressing your immune system to prevent organ rejection, you are also suppressing your immune system, which allows for opportunistic infections to take hold. So patients have to be very careful about what they come in contact with, making sure that they're washing their hands. Most things that we could fight off normally with our immune system, these patients wouldn't be able to, because we have inhibited or hindered their immune system. Close follow-up for these patients happens for many years down the road to make sure that everything is working properly. They will do blood work, they will do CAT scans just to make sure that the kidney is functioning the way that it should. So cyclosporin is one of the go-tos for immunosuppressant therapy in keeping and preventing organ rejection. It does have an increased risk of infection, and cyclosporin is actually considered a hazardous agent, so you have to have precaution when you're handling it. Gloves, if you're in a hospital and you're delivering this medication to a nursing unit, you must have the proper auxiliary labels and warning labels on the bag that you're delivering it to the nursing unit for. The reason for that is that you're going to work with many different nurses daily, weekly. You may get to know some, you may not, but the thing is, you don't know who's pregnant and who's not pregnant, right? Sometimes it's not always obvious for a few months. So we want to make sure as pharmacy technicians that we're protecting all staff involved. So we have to make sure that we're letting whoever's going to take hold of the medication and give the patient the medication, so that administration process, that they are also protecting themselves in the proper way, because it is considered a hazardous drug. Interesting thing with the cyclosporin is it should never be consumed out of plastic or styrofoam, because it will bind to the plastic, and when that happens, they're not getting the full dose that they need, and that puts them at risk for organ rejection. All right, we're going to go ahead and pause there. So slide 28 is where we finished off. If you have any questions, please feel free to give me a call, send me an email. I'm happy to help.